what the doctors have been telling you all along. So you're doing it in reverse, and it's not your fault. It's because, and I kind of blame it on the doctors, but I don't blame it on the doctors because that's the way that they're trained. They learn in school to medicate you. That's how they make their money. They don't make their money off of healthy people, and they don't make their money off of dead people. So it's the sick people. So once you get sick, they will keep you on those drugs forever. So a good doctor will try to get you off the drugs as quickly as possible. Okay. So all along, all these years listening to the doctor, and this is the same problem as what my adopted father had. He died from type 2 diabetes. I'm sure you're aware of the complications that come along with it. With 75% of diabetics die from heart attacks. They have kidney failure, so they go on dialysis. So he was on dialysis. He had both legs amputated because of gangrene. He was 95% blind. It was all because of sugar. And he listened to his doctors. He wouldn't listen to me or any natural doctors that are out there. An MD would be the last person I would go to for health concerns. I would go to a DO, which is the doctor of osteopathy, or an NP, which is a natural pathologist. So those are the doctors that I would go to. MDs, all they're trained for is two things: how to perform surgery and how to prescribe medications. That's the only things they go to school for. They have one class in nutrition, and that's it. So they don't know anything. They know very little about nutrition unless they go off on their own and learn it on their own. But inside the school, they're not taught any of this stuff. Okay. So you're going in at reverse. You're feeding your insulin. You're telling me that you're taking all this insulin, 80 units, 400 and some odd units throughout the day, and then you're fine until nighttime. In the middle of the night, your sugar level drops. And your sugar level drops because you haven't eaten to support all that insulin. So your insulin level, I believe, needs to be reduced. And I can't do that because I'm not a doctor, and I can't tell you to do that. What I can say, my job is to give you information so that you can have a better discussion with your doctor, okay? And explain to him what I'm telling you of why, and then maybe if he's a good doctor, he'll consider that, and then he'll work with you. If he does not want to work with you, you need to find a different doctor. He's a horrible doctor if he doesn't want to work with you. If all he wants to do is give you medication, send you off on your way, that is not a good doctor.
She don't, because I had tried to talk to her about the